So guys, today I want to talk about malnutrition, and this is going to be very helpful. In fact, malnutrition is a very serious disease that needs to be addressed so that you can know your balanced dieting, how you will take it for you to avoid malnutrition cases. So malnutrition is an imbalance between the nutrients your body needs to function and the nutrients it gets. It can mean undernutrition or overnutrition. You can get or you can be malnourished from an overall lack of calories, or you might have a protein, vitamin, or mineral deficiency. You might also have more excess calories than your body knows how to do with. And when we talk about types of malnutrition, we have undernutrition and we have macronutrients undernutrition. Again, we have um, we have overnutrition. Overnutrition, we have macronutrients overnutrition and micronutrients overnutrition. So we have said about undernutrition, we have talked about macronutrients undernutrition and micronutrient undernutrition. We have also said about overnutrition and macronutrients overnutrition and micronutrients overnutrition. So the words that you will mark there is macro and micro. And diseases that can be caused by by malnutrition, we have marasmus, kwashiorkor, anemia, goiter. We have hypernatremia. We have vitamin deficiency. And what does malnutrition affect? Malnutrition can affect anyone. Lack of knowledge of nutrition, lack of access to a variety of food, sedentary modern lifestyle, and economic disadvantages are all common contributors to malnutrition. The population more at risk of undernutrition, they include poor and low income. Yes, poor and low income. Again, we also have children. We have chronically ill elderly, and population more at risk of overnutrition. They include poor and low income, sedentary, desk job, and family obligations. What are the signs and symptoms of malnutrition? Undernutrition may look like low body weight, we have prominent bones, detected fat and muscles, and stunted growth and intellectual development in children. We have weakness, fatness, and fatigue, irritability, apathy, or inattention. And again, when we talk about when we talk about these signs and symptoms of signs and symptoms of malnutrition, we can also add more by just brainstorming. And this more that we can add are like dry, inaesthetic skin, rashes, and lesions. We also have hair loss and hair pigment loss. We also have frequent and severe infections. We have low body temperature when you are unable to get warm, and low heart rate and blood pressure. So, overnutrition might look like obesity, high blood pressure, insulin resistance, heart diseases. So, that is about overnutrition. And what are the causes of malnutrition? When you talk about the causes of malnutrition, we have limited financial resources, limited access to nutrition foods. We have medical conditions that make eating difficulty, such as nausea or difficulty in swallowing. We have medical conditions that deplete calories, such as chronic diarrhea and cancer, an extra need for calories, such as during pregnancy and breastfeeding or childhood. Overnutrition. Overnutrition is caused by consuming more nutrients than you need, or you might you might do this if you have few nutrition food options. As yeah, that is one. That is one of the overnutrition caused by consuming more nutrients than you need. So you might do this. You might do this if you have. We have few nutrition food options, a sedentary lifestyle, a condition that slows down your metabolism, such as hydrofluorokism, and then we have a hormone imbalance that interferes with your hunger and fullness signals, and chronic stress, anxiety, or depressions. We have binge eating disorders, chronic overuse of dietary supplements. And this is now all about malnutrition cases. Avoid malnutrition. But when we go to the community and we have patients with these chronic illnesses, what we do, we test them using a MWAC tape. A MWAC tape, it has a red, yellow, and green color, whereby when we use it to your upper arm, when we measure it around your upper arm, that is between the elbow and the shoulder, when it comes at yellow, we know that you are moderately malnourished. When we come at it comes at red in color, it has some readings there. It means that you are severe malnourished, and when it's at green, you are nourished well. Let me add something very little about open defecation. Open defecation is the emptying of bowels in the open without the use of proper designed structures built through handling of human waste. And such as human waste, such as toilets, open defecation is particularly associated with rural and poverty-stricken regions in the world. And some of the causes of open defecation are like lack of access to modern toilet facilities. We have misuse and misconception of toilet facilities and unsafe toilets. And when we want to talk about some of the effects of open defecation, we have like environmental pollution. Open defecation leads to devastating pollution of the environment and increase of child mortality rate. When we talk about child mortality rate, this is when children under the age of 5 years are particularly at risk of dying from diarrhea, since they are at a very high risk of susceptible diseases. We have malnutrition in children, very important. Once a child is a victim of one of these diseases, to be contracted from lack of proper sanitation and hygiene, they will begin to lose a lot of fluids and lack of appetite of food. These children, they will become malnourished and the immune system weakens, leading to the disease like pneumonia and tuberculosis, that is TB. And we have child stunting. When a child does not eat well, growth becomes stunted, and the child does not retain enough nutrients in the body to aid healthy growth. We have gender based violence. This mostly happen to women and girls. And sorry, so some women and girls don't like to use public toilets due to lack of privacy, such as women fall prey to sexual violence such as rape and assault as they enter unsafe places like bushes to defecate. We have increase in waterborne diseases. When we talk about increase in waterborne diseases, diarrhea and other problems associated with ingestion, introducing food to the mouth, and exposure of human waste affects children under the age of 5 years and most, since they are very susceptible to diseases. We have vector-borne diseases. These are just the diseases introduced by insects. When human waste collects into heaps, it attracts flies and other insects. When you are eating food on your sitting room, a fly, like, let me say, like, yeah, flies, the ones that they fly all over in the house, they might be coming from these heaps of the waste that has been brought in the bush, and they will fly over to your meals, and you might be getting these diseases from the fecal, that is now fecal oral diseases. We have harmful effects of open defecation on the environment, and they are two. We have contamination via microbes and visual and olfactory pollution. Effective solutions to open defecation, we have like provision of toilets. First, there is need to ensure that there are enough toilets, And then we have corrective civic education. When we talk about corrective civic education, another platform that needs to be addressed is the negative culture associated with people having toilets. The people should be informed that and given civic education to enable them to break away other cultural beliefs. We have other cultural beliefs on such as facts that toilets are not supposed to be shared. Yeah, that is a belief in some cultures. We have increase in public hygiene and participation by creating government programs that encourage sanitation and personal hygiene. Individuals must be involved and forced to take up the responsibility to enhance the hygiene as well as overall health. And achieving the sanitation target, a clear understanding is needed to what a clear understanding is needed to what to is needed of what prevents and what drives the transition from the open defecation using latrine. So that's all about open defecation. That's all that I wanted to share. And take this information very important about malnutrition and open defecation. Thank you very much for your time. And please, if you haven't subscribed to this channel, subscribe please and share widely so that we can support each other. And I really want to appreciate you for your time. Thank you and be blessed.